The U.S. Surgeon General, Dr. Vivek Murthy, joins us now. Dr. Murthy, I heard you loud and clear trying to get the word out, and I know that as the U.S. Surgeon General, you don't want to get involved in politics. In fact, politics aside, it's about facts, and it's about public health, and it's about getting the word, the right information to the American people. But I do have to ask you this. If Donald Trump held a press conference and it was covered widely across all networks and all media platforms, and he begged the American people, all of the American people, to get the vaccine, he showed a picture of himself getting the vaccine, and he said, don't believe what you hear on Facebook, could he turn this resurgence among the unvaccinated around, do you think? What are you hearing?
Well, Mika, I'm very concerned about the misinformation that's out there. I think it's preventing people from getting vaccinated right now. It certainly prevented people from wearing masks and protecting themselves in the past. But I think what all of us have an obligation to do, regardless of the size of our platform, whether we have millions of people who follow us or just a few people, is we have a responsibility now to not spread misinformation, to help people access accurate information. We know that there are about 2/3 of people who are unvaccinated right now who are saying they either believe common myths about COVID-19 or think those myths might be true. And so we've got to reach out to the people who trust us, family, friends, or our followings. If we have larger numbers of folks who follow us, we've got to let them know that the facts are that vaccines are safe and effective. They've saved many people's lives. And right now with COVID, Mika, we are seeing the surges of infection take place among those who are unvaccinated. In fact, 99.5% of deaths from COVID right now in the United States are happening among the unvaccinated. This is a tragedy, really, because every one of these deaths is one that may have been avoided if people would have been vaccinated. A year ago, we didn't have a vaccine because we were seeing people die and we didn't know how to stop that. Now we do know how to stop it. And it breaks my heart that we can't get accurate information to people so they can get this vaccine.
But beyond it breaking your heart, and mine too, actually, it's just painful to see so many people so misled to the point where this pandemic can rip through their families and take people away from them. But you mentioned reaching out to people who trust us. The problem is they don't trust you. The problem is they believe what you say is fake news, and they read Facebook or listen to someone who listened to Donald Trump once, and they don't believe you. What is the administration doing to stop disinformation and save the health of the American people?
Well, there are a number of steps that we've been taking and and more that we'll continue to take, but I'll tell you a few. One is we recognize that we're a big country. Not everyone trusts the same people or the same news sources. What we have to do is work in supporting a number of trusted messengers in communities across the country to help them get messages out to their communities, to the people who trust them. That's one of the reasons we've been working closely with faith leaders, with local doctors and nurses. And keep in mind, about 80% of people say they want to talk to their local doctor or nurse before they make a decision about the vaccine. Sometimes it's not always about what we say, what I say as Surgeon General. Sometimes it's about what I can do to support people in local communities. But the other thing that we are doing is we've been in conversation with technology companies. We are going to ratchet up certainly those conversations and engagements more. But we believe technology companies have a responsibility to reduce the spread of misinformation on their platforms. It's not simply enough to take a couple of steps and say, this might get better in a few years. Right now, today, misinformation is harming people's health. And if you run a platform, if you have a technology company that is in somehow inadvertently or contributing to the spread of misinformation, you've got a responsibility to take action to stop it. The tech companies have taken some steps forward, and I appreciate that. But there is so much more they have to do, and they've got to do it with greater urgency because we are losing people right now. We are seeing people lose their lives because of misinformation.
Dr. Murthy, I can hear the frustration in your voice, and I understand it, because what we've had in this country is a medical miracle over the last year. The combination of government, pharmaceutical companies, doctors, and scientists getting together to bring us this miracle vaccine that can stop COVID-19 in its tracks. And now here you are bumping up against Facebook posts that are stopping people from getting it. And as you talk about trusted partners, I'm thinking about a place like Alabama, where you've had Nick Saban, the head coach of the University University of Alabama, who's much more important in that state than the governor, frankly. Senator Tommy Tuberville of Mississippi, not always been on your side in many issues, but has spoken out. He was the former head coach at Auburn. Charles Barkley, a huge figure in that state. They've all done PSAs to say, go get vaccinated, and yet the rate hovers somewhere in the low 30s. So how do you break through that? And are you even in a position to break through that and to let people know just how important this is and just how deadly their action or their inaction is?
Well, Willie, I think that this is a very complicated and challenging problem. We are at the hard part of this vaccination campaign, and unfortunately, misinformation has been circulating for a long time, and it's now deeply embedded in many people's minds. But here's what we also do know. Vaccine confidence in our country is at its highest point in really the last year and a half, certainly since we've gotten this vaccine available in December. We also know that when people make decisions about getting the vaccine, often it's based on people they know and trust in their lives. Yes, people have heard of celebrities. Yes, they see folks on TV all the time, but that doesn't necessarily mean they trust them. The people they trust are often their doctors, the folks who provide them health care, their family and their friends. And that method of getting information out to people, relying on family, friends, local doctors and nurses, that takes more time. But that is the effort that we are engaged in right now. My hope also as people see the fact that COVID is not over, as they see infection rates rising in the country, as they unfortunately see hospitals starting to fill up again, which is tragic. My hope is that they will take a second look at the vaccine and realize that this is still our best pathway out of this pandemic.
Dr. Murthy, it's Kasie Hunt. My question for you is whether the administration waited too long to start getting these shots to local doctors' offices. I mean, you were pursuing for a while the max vaccination strategy, which obviously made sense when our supplies were short, but it was only recently that suddenly you could potentially get it at your doctor's office instead of walking into a public area or CVS, and there have been some efforts in places where there's a lot of resistance to allow people to get the vaccine in private. Do you think that you should have undertaken that earlier to try to make it more available to people in their primary physician's offices sooner?
Well, it's a really good question, Casey, because a lot of people do want to get the vaccine from their doctor. And from the very beginning, we knew that this was going to be an important channel. We knew that primary care doctors in particular were going to be critical partners. But in the very beginning of this effort, as you may recall, there was a limited supply. And the most efficient way to get the vaccine out to the most number of people was actually to set up these large vaccination sites in collaboration with local and state government and community organizations. But as the supply increased, we began urging states to get the vaccine into doctors' offices. Already, we've had thousands and thousands of doctors' offices which have gotten the vaccine, which are administering a vaccine each and every day to their patients, and that will only increase. So, we're going to keep working hard to make sure the doctor's offices have access to the vaccine. But this has been a priority from day one. Unfortunately, supply in the early days limited our ability to distribute vaccine to as many offices as we wanted.
U.S. Surgeon General Dr. Vivek Murthy, thank you very much for being on the show this morning.